Hello, Sonali. I'm Karen at the Royal College of General Practitioners. Could you just tell me a bit about yourself and your current role?
So, hi everyone. My name is Sonali Kindra. I'm an international medical graduate and I moved from India in 2004. I'm currently practicing as a general practitioner in North Central London, and I'm also a deputy medical director at the North Central London Integrated Care Board, as well as a trustee board member at Royal College of General Practitioners. As I said, I've moved from India. I'm one of three girls, and I've had the privilege to see primary care very much from the front line, working across primary care, out of hours, secondary care, and now also been involved in the evolution journey of integrated care systems and integrated care boards, while closely being linked to the college over the last 18 years.
Wonderful. And what was your first leadership role, formal or informal?
So leadership for me is very much, it's about an action. It's about something that you do. It's not about a title or a role. When I joined as a general practitioner in my practice in Nottingham, I was asked to look after a care home, which was a 32-bed residential care home. As a trainee, I had not had much experience in it, but one of the things that really pushes me is that if you don't know something, then you go in and learn, you get to know the people around you, and then you make it something of your own. And that's exactly what I did. So I went in, I got to know the residents very well, went back kind of through their entire life history that was there, but also linked in with the caring staff who were providing the care, the families, as well as the teams that were going into this care home, which was the community geriatrician, the physiotherapist, occupational therapist, to name a few. And we had success at it. We were able to not just bring down the admission rate to the acute sector by about 30 to 34%. We also really developed a relationship with the residents and with their families, and were able to provide them the care in their kind of preferred place and ensure that all their needs are being met. I then went on to actually provide, I was asked to lead on providing clinical leadership within another care home, which was a much bigger care home this time. But I think what I realized through doing this was the key elements of leadership are probably still the same. Whatever scale you may apply that to. It's about the human interactions, certainly, that you have. It's about enabling and empowering people that are there. But if you keep the patient at the center, at the heart of it, and you're all working towards a common purpose, which you do need to define, then you will get there. So for me, as I worked through this general practice that I was there for about 7 to 8 years, what I think I became good at was spotting people who were already leading in their fields. And this was our reception manager, who really knew how to corral people around. And, in the tough setting of being in the reception, our secretary, she was not only was she a brilliant secretary, but she was also very good at getting our social diary filled up to ensure that we had a real team working. So I think it's about identifying that in people, as well as to what is it that really ticks them. And there's each one has their skill set, certainly, with it, but it's more an action, and you can do that in your own spheres, but also look around you. People would be showing these skill sets, and it's for you maybe just to nudge them and give them the confidence and the self-belief that they can do this.
That's really interesting. And you talk about leadership as a journey. So what next after the care homes? Where did you move on to?
So some of the things that I was seeing, that the interactions that I was having with my patients, again, kind of in that sacrosanct space, so to say, in your consulting rooms, you do come across challenges. Some of these challenges are related to processes. Some of these are the artificial barriers that have been created in the system, which would make the patient journey not very seamless. So therefore, whatever interaction that I was having within my own consulting room, I decided to find out as to, it can't just be me who was facing these challenges. I'm sure there were others as well. So I started to step into the kind of arena of problem solving, which were problems that may have been across the system. And I went into the clinical commissioning group world at that time, what it was called, and I started as a maternity and children's services lead. and then went on to also become a GP retention lead. And I think it was really through that kind of problem solving, collaborative working in that multi-professional space that I ventured into the space of strategic thinking, but also how do we operationalize, ensure that processes and systems are in place. Having done that very much within the CCG space in Nottingham, I then had to move to London because of personal reasons. And just I was moving to London, that was just before the pandemic. At the practice level, just as all of us had to change our processes overnight, in the practice that I joined, which was early on in January 2020, I put systems into place on how to develop for our digital offering to patients, online consultation and others, and a lot of other processes that needed refreshing as well. I was then asked by the national team at NHS England to join them as a clinical associate, and I went to work with Dr. Nikki Kanani for 2 years. With predominantly my portfolio was around workforce retention, but I also worked in the areas of hormone replacement therapy. Of course, as the COVID guidelines were working, it was a very dynamic and fast-paced change that was happening, but equally in areas such as the additional role reimbursement scheme for their supervision. And probably the bit that I really, put in a lot of time and effort was about the increasing violence, aggression, and the incivility behavior that we were seeing in primary care, and what methods and what things we could put in place to reduce these behaviors. So those were some of the things that I did within the national space, and then recently joined as a deputy medical director in the ICB, which is an evolving space. Integrated care boards only came into being in July 22. So we're all trying to learn what this really means, moving away from that commissioner provider split to a more collaborative way of working, which is built on respect and mutual trust.
Thank you. That's really helpful lessons for others. What about the Royal College? How have you been help supported or supported others? What's the college been to you?
So as I said, I moved to this country in 2004 and became a GP in about 2008. And I, again, started in a new area in Nottingham. I'd had my training all in Kettering, but being married to a surgeon, he got his number training in Nottingham. So we moved to a new city. And one of the few things that, my colleagues told me that if you want to, get to know your colleagues, build networks, and if you have, you're inclined to learn more about the college that you're a part of, then go and join the faculty. So I went and joined the Vale of Trent faculty at that time while I was working in Nottingham, which was through very much an evening meeting. I think that they had organized. CCGs were coming into being at that time. So actually it was a meeting that was organized by the college to explain to us what it really meant in the world of clinical commissioning groups. So that was my introduction to it, being with like-minded people in the Vale of Trent faculty. And so we would attend, I started by attending their evening meetings, which would be at the end of a long day. But really the topics that were being discussed, which, one could put into kind of two boxes. One was about the professional development, certainly, but second was also about our day-to-day, what was impacting us within our practice. And it really helped to kind of connect those two dots. What was it that we had been trained to become, and how that was impacting the care that we were providing to patient. So I joined the Vale of Trent faculty initially as a member, then went on to become a deputy treasurer and also the vice chair of the faculty. And we had an opportunity to run various projects through this faculty. I was involved in the professional development program that we did. We also went on to win an award for the Faculty Innovation Award, which was on improving the interface between primary care and secondary care. And we produced a video with really our aim was that with this video could be shown to when new trainees would get inducted into any hospital or trust, we would speak to them about what do you do when a patient does not attend a clinic appointment, your onward referrals, completing your discharge summary, sick notes and other things that we are still actually struggling with. And the Royal College GP has just endorsed a consensus document on this. So I went on to do that, certainly within the faculty level. But at that time, I don't think I would say, while I understood how the faculty used to work, I did not completely understand how the college, the central college, was working. So I was asked by one of my senior colleagues, again within the college, that if I wanted to attend as an observer for the council meeting. And that's what I did. So I came to London to attend as an observer, and it was fascinating to hear the conversations that were happening at the council and people who were working really hard to improve our day-to-day life. So did that, and while I'd not stood for a faculty role within the council, as I said, then I moved to London, certainly just before the pandemic, and stayed involved with the college as the college was moving forward with improving or refreshing the equity, diversity, and inclusion agenda. And they had set up these short working life groups equivalent at that time. And I was involved in some of those groups, which are about adequate representation. Also during the Black Lives Matter movement, when we were talking about adequate representation, equitable representation, we were quite aware of the fact that the council really wasn't reflective of the general practice workforce. And I thought, well, there's no point in us just thinking or talking about it. We need to put ourselves forward. So I actually put myself forward as a nationally elected council member, but also corralled people to put themselves forward. And 2 years ago, I think in November 2020, 6 people who got elected, 5 out of those 6 were from ethnic minority background. And it was really a success at that time. And we all got together with wanting to ensure that there was equitable representation. So I've been on the council since then. When I joined the council, it takes you some time to get to know and understand the workings of, the council, the kind of tripartite. How does the council work? How does the trust work? How do the officers work? Very much early on into my stint at the council, I brought a motion to the council. So again, it was, learning how the council worked. This was about the CQC ratings of our practices that were led by ethnic minority colleagues, which had a resounding success, but also then how that impacts the policy, the strategy within the college, the engagement that they were having with the CQC body. So I've been there on the council now 2 years. This year it comes to a close. And then while I was in the council, people said, well, have you thought about the trustee board? This was me still trying to understand the workings of the council, and by a little bit of a nudge from people around, but equally wanting to understand how does this organization work for the members, and for the patients, but also for the people who are employed by the college itself. So that's what I went on to do. The council members elect one person, 2 people, I think, to the trustee board, and I got elected, and I've recently started again about 4 months ago in that position. Very much new in that role, trying to understand what is the role of a trustee board member, which is different from when you are a council member. Your corporate responsibility to the charitable organization and to the charity commission is certainly something one has to make sense of. So you may call it, serendipity. You may call it has been maybe a thirst to learn more, certainly, and learning by seeing, by doing, and then of course, making sure that people who follow me, I'm able to impart that knowledge as well. So I hope this is going to may inspire some people to come and join the council as well as then the trustee board.
That's wonderful. And I think that's a wonderful note to end it on, unless there's anything else you'd like to share with our colleagues across the country.
So I'll quickly talk about my 5P model that I tend to work on in terms of leadership and things that have been helpful for me. I think first is finding your purpose and the thing that really motivates you and encourages you. And that sometimes comes through trying out different things. When I got into general practice, ICBs didn't exist, clinical commissioning groups didn't exist. So make sure you try out different things and see the thing that really motivates you. Second is finding your people. And by that, I don't just mean your peers, absolutely important, and college has been instrumental in that, but also make sure you find your mentor, get yourself some coaching. And what has really been helpful for me is the sponsorship model. I've been running a primary care Black, Asian, ethnic minority sponsorship model, the first of its kind in the country. So these your sponsor is your loudest cheerleader. They say, kind of the mentor gives you perspective, but the sponsor uses their social and political currency for you. So find your purpose, find your people. Third is putting yourself out there. Use social media, whether it's Twitter, whether it's LinkedIn, to really connect with people out there. Some like-minded, but some also people who will give you a different nuance, a different lens to see, a different perspective to see that. Fourth is I have pose questions. Always be curious. It's good to go and ask the why as to why we're doing something. And it'll get not just from the point of view of annoying people, but trying to understand really why are we doing what it is that we are doing. And the fifth, I would say, is pay it forward. Make sure that you lift as you climb and you keep the door open for the people who are following you.
That's a perfect note to end it on. I want to thank you very much for your time. Thank you for sharing your insights. And we'll be sharing this with all our members across the college. Thank you.
Thank you.
Right.